I'm Cockerell, Communications Director here for the City of Abilene, and we're here with two guests from the Betty Hardwick Center here in Abilene. We have Nancy Elliot and Nikki Parkhill, who are here to talk to us in particular about something that you may have heard a little bit about, but we really want to make sure people are knowing what's out there. There's a hotline available right now with free help, mental health assistance during, especially with this COVID time. Because it's been a challenging time for everyone in some way or another, and it's a little crazy out there, you know. And so, but of course we mean that in a very serious way as well, because mental health is something that we really need to take a close look at all the time and really give so much attention to, but especially now. So thank you for coming to talk about it.
Thank you. Thank you for having us.
So first, give us, for anyone who might be a little unfamiliar with Betty Hardwick and what you guys do, you see it there off a clack, you know, on the sort of southwest side of town. So what happens at Betty Hardwick sort of normally, and what's going on there?
We are a community mental health center, and we provide services, adult mental health services. We provide child and adolescent mental health services. We provide help for children with developmental disabilities from age 0 to 3. We provide services for people with intellectual developmental disabilities. And that can range from case management to service coordination to medications and a psychiatric medical clinic. And we provide forensic services for people in jail. And we provide just a crisis line, a 24-hour crisis line for anyone that's having a mental health emergency within our 5 counties.
And that's all the time?
That's all the time.
All the time. And so now, as we got into this time of COVID, Nikki, for you, you really head up what has been the special COVID help that's been out there, and it's coming through the state. Tell us a little bit how this developed.
It's coming from the federal government.
Okay.
It's a grant through FEMA.
Okay.
And it's funded to provide short-term mental health services for people who are struggling with any kind of emotional issues having to do with COVID-19. So frustration, confusion, anxiety, tired of messing with it, which I think is going to hit a lot of people right now. Any of those issues, we have a free helpline that's answered 24/7 for people to call and just talk to someone. And if they need more services than that, then our operators will, who are trained mental health professionals, will refer them or offer resources to them.
Yeah. And so, and what does it look like now? I think so many of us are just kind of making do, and you might not realize that you could benefit from some help. You know, someone would talk to you like, hey, it is hard. I mean, it's hard for everyone. Yeah. But so what is maybe a need for maybe some mental health attention or just care or self-care? What does that look like? What might it look like in your life today, I guess?
Well, one of the things I read recently said that 90% of Americans are really struggling, more than somewhat, but very much struggling with issues around COVID-19, emotional issues. So that's pretty much all of us have had some kind of emotional strain in our lives because of this disease and this pandemic. So it looks like someone who's trying to wear several hats at the same time, especially as a mother. We're really looking at mothers right now. You're trying to do homeschooling with your kids and work and run a household and take care of all the other things in your life, and you've added homeschooling on top of it. So a lot of the frustration and anxiety of, I don't know how to work this computer, and we have to get this assignment in today, and I don't know how to do it, and my child doesn't know how to do it. There's just a lot of frustration that we would not be dealing with if COVID-19 hadn't changed the way we live.
So if you call in, could you maybe even find and learn new tools of how to deal with those stresses?
Absolutely. And one of the things that we're working with is helping people realize what stress looks like, and especially in their children, because they don't think of their children getting stressed, but they are. So what to look for in your child and some tools to help combat that and help your children learn how to cope with it. Children don't know coping skills like we think they should. We just help them out. We just give them what they need, and they don't really learn to cope. And a lot of adults haven't either. So we teach coping skills and how to handle whatever situation that you're in.
Yeah. And the social aspect for them too. It's hard for all of us, but for ones who may be
Absolutely.
at home more than others and not seeing their friends.
Right.
And then once other friends did go back to school and did go back into a classroom setting and they're seeing the kind of missing out or whatever, that's a whole other element.
That's a whole new element.
Yeah. And so tell us too, I was thinking about this, and it's what's interesting, I think, with COVID in particular is that obviously this is serious and it's a huge thing in our lives, but it's not like we're completely at apocalyptic time. Like you see in a movie of like Mad Max or where it's like, so I think if we were in that setting, we would all go to a like, okay, life is totally different and we need to be ready to go to this, you know, like it's just survival, the fittest completely. But we're not, we're in this sort of normal life, but not normal life. And I think in a lot of ways it's harder, at least mentally, you know, maybe not physically, we're not having to go out and hunt and live off the land and like, this is the end of times. But really is mentally so much harder because we're trying to be normal-ish at the same time.
Right.
Yeah.
And I think that when all this started with COVID-19 back in February and March, I think we all thought this was going to blow over pretty quick. And now there seems to be no end to it. And people are starting to struggle with what I call COVID fatigue. We're tired of it. We want things to go back to the way they were.
Yeah.
We want to be able to get on an airplane and go somewhere. All of us want to get away because we've been homebound for so long, or community bound for a long time, and shrunk our circles of influence. So people want to be able to get back to normal. They want to go out to dinner as a family or have family reunions. And we just simply can't do that yet. And now we're coming into a season of holidays. Like, how are we going to do trick or treat? I mean, there's just a lot of questions out there. So I think we're just tired of dealing with all this. And so a lot of people have dropped their guard. So one of the things I'd like for us to be sure people understand is that we need to continue to do all the things the CDC has recommended, the hand washing, the masks, the social distancing, all of those things are still important. And if we relax them, we're going to go back to the way it was 2 or 3 months ago where it's everywhere. So we have to be vigilant, especially with the holidays coming.
Yeah, absolutely. And so, like you guys said, you know, there's a hotline. Folks are welcome to call, and if anything, if it's worth calling to find out what you might be able to get some help with, even if you think, okay, maybe I don't need mental health. But, you know, those little tools and things you can pick up helping out, just dealing with kids' education or just the extra stress in the house can be really helpful.
And I think it's also important to know that you don't need to be, it's not affiliated really with being a Betty Hardwick Center client.
Correct.
This is absolutely separate and just a service to our community.
It's totally anonymous.
And it is anonymous.
So if you work somewhere where you're afraid that if your manager finds out that you're reaching out for help or telling company secrets or whatever, you don't have to worry about it because it's going nowhere. It's totally anonymous.
Good.
So,
Yes.
and you don't have to be a wreck before you call.
Yes, but let's call
it's just
prior. Help
anyone who wants a little bit of help or just needs somebody to rant with.
Yeah.
And I do sessions with small groups where they just rant, and I let them. I just facilitate a rant.
It can help a lot because
That's right.
because of the political aspect of all this, you may find that you're not really able to talk about it with family because it gets into a little bit of mixed company and like, oh, we don't want to go there. So you just need someone to rant and talk about,
That's
or maybe
right.
talk about your cousin so-and-so and how they just drove you nuts
That's
at lunch
exactly
and like, I gotta get this off my chest.
So I'm available to go to different businesses or to a family's home and just visit with them and let them rant and offer some coping skills and that kind of thing.
Gotcha.
So that's one of the services that we're providing is small groups. And
Nice.
then I also will go to like Lions Club or any of the, like Kiwanis or any of the clubs and do presentations about COVID-19 or stress management or any of the things we're kind of coping with right now.
Okay. Well, that's great. So maybe as an
So it's a
employer
real
too,
resource.
give a call and see if maybe help out with your workforce or whatnot. So, well, thank
Correct.
you
Thank
so
you.
much. Yeah, of course we'll have information out for everyone as well, but reach out and get the help you need.
Thank you so much, Maury. We
Yeah.
appreciate it.
We got more online too at abilenetx.gov.